Alberta's top doctor says the worst of an especially bad flu season is now behind us. The last month has been extremely hard on hospital staff and patients, as overcapacity has led to excruciatingly long waits and even an Edmonton death. Tim Brooke has more on what happens now and why we're not completely out of the woods yet.
Alberta's new Chief Medical Officer of Health has some welcome news.
Case counts are beginning to fall, and the number of Albertans admitted to hospital with influenza A is starting to drop.
According to provincial data, flu cases have now peaked. That doesn't mean we're home free, but it does mean the system should soon be better equipped to handle a new flu strain.
Influenza B often emerges later in the season, and while these waves tend to be smaller and associated with milder outcomes in immunized Albertans, they can still cause significant illness.
Influenza hospitalization numbers are still unusually high, and a lot of that is due to a low flu shot uptake. Currently, 74% of patients in hospital did not get immunized.
Even though the viruses are starting to abate a little bit, we're still seeing very high volumes.
Those on the front lines are still worried about Alberta's emergency departments and their sky-high wait times. Many tell CTV News they blame the government's AHS restructuring, saying it's led to poor communication around patient discharges and internal organization.
That's what we've kind of lost a little bit in the restructuring, and hopefully we can get some coordination back.
Patients feel the stress too.
It's really upsetting when you hear of people that are dying because they don't get the proper treatment.
None of Alberta's health ministers were made available to the media Tuesday. So we asked the Chief Medical Officer of Health what lessons can be learned and used moving forward.
That's probably a question that better goes to later this week to Acute Care Alberta.
That office is promising more capacity and 336 dedicated beds for respiratory virus season. Questions about the timing went unanswered.
The Premier and the ministers should be available, should be accountable, and should be stepping up when we're in crisis. And we are in crisis.
Another provincial health update is scheduled for Thursday. Tim Brooke, CTV News, Calgary.